To find out if you qualify for a complimentary consultation, call our office today at 407-977-3842. This visit is normally $245, but will be provided at no charge to those who qualify today. This offer is only for those who have been previously diagnosed with type 2 diabetes and are currently taking medication. Call now or visit myiho.com.
Welcome back to today's Better Health. Okay, we have discussed why type 2 diabetes is so prevalent and how traditional treatment addresses the symptoms. Now let's get to the good news. Tell us how your approach is so different.
Well, first of all, like we were just talking about, the testing that's done is pretty narrow. What we need to do is really figure out exactly what's going on with the patient. We need to look at the patient as an individual to see where the dysfunction is coming from. We need to figure out why they have diabetes and where in the body the organ system is going wrong. And at that level, then we can actually start treatment.
Yeah, the standard approach to testing with this is essentially a few narrow blood tests that identify that your blood sugar is elevated and that your hemoglobin A1C is elevated. And that's pretty much where things stop. I mean, at that point, the diagnosis can be made and treatment then just starts. You know, there's nothing more done. So it has to go beyond that. You know, we have to be able to dig deeper than just being able to put the label on that someone's a diabetic. We have to be able to look beyond that to see what are the actual causes, where are the organs malfunctioning, where is the endocrine system not communicating the way that it should, what things aren't signaling properly. And that really means testing in a very elaborate way. You've got to really test through all the organs that can be involved in blood sugar control. And so most people are so keyed in on the pancreas, you know, being involved because that's where insulin is produced. But, you know, really that's a rare problem for most type 2 diabetics. You know, in many, many cases, the pancreas is producing lots and lots of insulin for them, certainly enough for them to function as a non-diabetic. The problem has nothing to do with that. It's in other areas. It's things like insulin resistance, and no testing is done to figure that out. Or it's in other organ systems that really affect how blood sugar is controlled, like your adrenal glands. You know, they make some very powerful hormones that affect blood sugar. So there's a lot of other underlying possibilities involved in a diabetic, and that's where testing really allows us to identify why, you know, a person as an individual is a diabetic, not the masses.
So you do a lot more testing, a wide array of testing, and do you also ask the patient a lot of questions maybe about their lifestyle or things that they're doing in their life, maybe stress or other things that might have an effect on their health?
Of course, there are a lot of other key factors that are very important to understand about the patient. We need to know the patient's story. We need to know how the diabetes progressed to the point that it's at now. And a lot of that we see through the blood work and then all of the other different types of lab work that we do as well. But of course, we need to know the patient's story as well. But then, you know, the lifestyle changes, some of them, you know, times they need to be made pretty drastically. But it really goes beyond that. You know, diet and exercise alone is just, it's not enough to change the course of this disease. Losing weight is not going to heal the physiology of the body. So we really need to get down, you know, at a deeper level with the treatment.
And everybody has a different story and different genetics, so it's much more complicated than most people think.
Right. And they're generally confident, or hoping at least, that, you know, if I just lose some weight, I get my diet in line, that this thing will magically go away.
Right.
And lo and behold, a lot of them do that and find I'm still a diabetic. You know, I'm not better. Things still aren't working properly. And that is why we have to look so much deeper. You know, we have to be able to look at things like how the digestive tract is functioning. You know, is it absorbing things properly? Is it not? Are there issues going on in just that system that could be contributing to the problem? That's just one, you know, small area that has to be looked at. There's such a broad possibility of things that can contribute to causing diabetes for a person that you really have to be able to, you know, step back and take sort of that 30,000-foot view to see the whole of the person, not just the label of diabetic.
And very few people understand physiology and how all these internal things work together. So coming to someone like you can really be an eye-opening experience, I would imagine.
Yeah, absolutely, because it really is important once we get the biochemistry right of the body, then we can get the whole body functioning like it should, because diabetes is really affecting every system.
Well, this has got to be really good news for someone who has been struggling with this disease for years. When we come back, we'll hear more about this customized approach to treating type 2 diabetes. We'll see you back here in a minute.